Well, welcome everyone. I think most everybody on this screen knows who I am, but I am Elise Eifert. I'm the graduate coordinator for the fully online graduate program at UNC Greensboro. On behalf of the gerontology program and myself, thank you for being with us tonight. We have an exciting agenda. I'm going to turn this over in a second to Dr. Chantel Caro, who's going to share information with you about Careers in Aging Week. And then she's going to pass it on to Danielle Dunn, who will tell you about Sigma Phi Omega and introduce you to our wonderful speaker tonight, Dennis Streets. And then Mr. Streets' presentation will be followed by a brief question and answer, and we should be done by 8:15 at the latest. So let's go ahead and get started. Dr. Caro, I'm going to turn it over to you.
Hi, everyone. As Elise already said, my name is Chantel Caro. I'm an assistant professor in the gerontology program and the faculty coordinator for Careers in Aging Week for this year. Careers in Aging Week was created by the Gerontological Society of America to raise awareness about the diverse careers available in the field of aging. And we all know here on this call that people are living longer and populations are aging worldwide, and the demand for professionals with expertise in aging is growing rapidly. So our event tonight is our kickoff to our Careers in Aging Week for 2022. And the official week starts April 17th through the 23rd. We have a lot of really great things planned, so please check out our social media. At the end, I'll drop the links for all the socials in the chat. And the gerontology program is on Facebook, Instagram, and LinkedIn, so I'll drop all those. And all of those have information about our events, and the gerontology website has links to all those things too. And lastly, before I turn it over to Danielle, we would like to encourage you all to be vocal about careers in aging during this time, during Careers in Aging Week, and share your own stories about your own careers in aging and encouraging others to pursue careers in this field. So Danielle, I will pass it to you.
Thank you, Dr. Caro. Good evening. My name is Danielle Dunn, and I'm the student president of the Delta Gamma chapter of Sigma Phi Omega, the International Academic and Professional Society in Gerontology. Sigma Phi Omega recognizes the excellence of those who study gerontology and the service of professionals who work with or on behalf of older persons. Sigma Pi Omega seeks to promote scholarship, professionalism, friendship, and services to older persons, and to recognize exemplary attainment in gerontology and aging studies. On behalf of UNCG's SPO chapter, who sponsored this special Careers in Aging Week event, I would like to introduce our speaker. Dennis Streets is the recently retired director of the Chatham County Council on Aging. Prior to that, he was director of the North Carolina division of the Aging and Adult Services. He earned his master's degree in public health with a concentration in health administration and policy, and a Master of Arts in teaching with a concentration in communications. Both of these are from UNC Chapel Hill. He also has his Bachelor of Arts in Political Science, also from UNC Chapel Hill. Since retiring, and for those of you who are only listening, I'm facetiously using air quotes, Mr. Streets cannot stay away from his gerontological pursuits, and he is volunteering in several ways, even as he tackles long honeydew and wish lists. He serves as board chair of Chatham Hospital's Planning Committee and is active on the board of North Carolina Senior Games. Most recently, he agreed to serve as co-chair of a newly formed task force on healthy aging for the North Carolina Institute of Medicine. In addition, he is completing his role as preceptor for a UNC Chapel Hill public health capstone team. Thank you, Mr. Streets, for being with us this evening and for your proven dedication and service in the fields of public health and gerontology. Without further delay, I turn it over to Mr. Dennis Streets, who will share his presentation, Aging Isn't Just a Job or Career, It's a Passion. Thank you.
Thank you, Danielle. And I'm bringing up the presentation. Hopefully here, can you see it?
Yes.
All right, great. First of all, I want to congratulate UNC Greensboro for what you're doing with Careers in Aging Week and for what you're doing in leading the efforts around gerontology in North Carolina. You'll see from the title here, but also from my remarks, my dedication to this field. And I really do sincerely appreciate all that you are doing. This title, Aging Isn't Just a Job or Career, It's a Passion. I can't take credit for in the terms of the words because Krista and I had worked together, and she'll know one of our colleagues, Barbara Woody, who sent me a kind note as she heard I was retiring, and in her appreciation said that I had conveyed not only in words but through actions this sentiment that it's not just a job or a career, but rather it's a passion, and one that she has certainly embraced and does outstanding work in support of our services here in Chatham County. Tonight, I really wanted to go ahead and touch on not only how I came to choose this field of aging, but also what experience I've had, and talk some about why, and it's already been talked about by Dr. Caro, but why aging in this year, but well beyond, is so important. And also for those who are considering a career, where you might begin and things that you might consider. So the roots of my passion, we were talking a little bit about this before the call started, but my history through my mother goes back to the late 1800s in St. Petersburg, Florida. And this is where I grew up. I was born and reared in Pinellas County. Now, I don't remember this exact street scene, but I do certainly recall large numbers of older adults. And I remember Johnny Carson, who had the late night show, remarking about the green benches that you'll see here that became a famous symbol, if you will, of older adults and aging in Florida and in St. Petersburg particularly. I actually, my passion really began through the work of my father, Dr. Benjamin Franklin Streets Jr. Was the son of a coal miner. My grandfather actually started in the mines of around Sutersville near Pittsburgh at age 9 and worked in the mines until he was 65. He did not want that path for his son rather, if he could avoid it. And so my father was the first to be able to go to college and then went on to medical school at Hahnemann in Philadelphia. And he was a general practitioner. And it turned out my mother, who was again from Florida, was in the Pittsburgh area as a beautician, and met my father, and eventually convinced him to return to the Sunshine State for most of his years of practice. And again, that's where I was born. My father practiced in medicine until he was 77, and probably would have been later, but he became a caregiver for my mother. And so he had a 50-year medical history, but I called him medical missionary because so much of his work was such dedicated to, again, as a sort of a self-proclaimed gerontologist, to people even before there was health and before Medicare. They would come see him, and oftentimes, if he charged him, it was very little. I used to kid him that he had one of the early senior centers, because people would come and sign their name on a list. There wasn't so much appointments, and he would see everybody on the list. And he had card games and checkers and had a covered outdoor porch. And they would see him and then stay on to maybe chat with one of their friends, or maybe a stranger they had met that day who became a friend. Again, this passion that I enjoy was rooted in his work. This image of my father is actually talking to my brother David, and David also didn't so much become a professional in aging. In fact, he was more a genealogist, but he was the caregiver for both my dad and my mom and my Aunt Eva, and took care of them for many, many years, and eventually actually became a certified nursing assistant and worked in an assisted living facility. But my experience, not unlike my grandfather, certainly not in the mines, but I worked in my father's office at age 9 for many years. And he taught me some simple lab tests. He actually let me, if you will, become the receptionist for a good bit of time. And I was able to spend more time with him because his schedule was so busy, by riding with him on house calls and board and care, as they called it then, visits and nursing home visits. Again, I probably would have either really developed this passion for aging or gone as far away from it as possible. And thankfully, I kept that passion. My experience was, after going to junior college, St. Petersburg Junior College, for 2 years, I did transfer into UNC Chapel Hill in 1972 with that passion for aging, but found only one course on campus, a sociology course that had anything to do with the field. And so my opportunities academically were limited at the time, but I still worked out opportunities in the community. And this included following a speech pathologist into nursing homes to see her work with aphasic patients, learning about a local nursing home whose conditions were deplorable. And I just became a friendly visitor and became part of a group called Nursing Homes, Friends of Nursing Home Patients. And that group eventually was instrumental in advocating for what became the state's resident rights for nursing homes, and eventually domiciliary residents as well. In the early years of the hospice movement in Durham and the Triangle area, I had an opportunity to participate in some of the planning meetings. Again, these were, if you will, extracurricular, but you had to find those opportunities to pursue that interest. I did go on to get my master's in health policy and administration. And even there, I brought up this interest in aging, and really people frowned on it at that point, and said, I don't think that's a public health issue. And I thought to myself, sure, it needs to be. And in fact, I remember reaching out to, after I looked at a number of years of the American Journal of Public Health, and finding maybe a couple articles on home health, but nothing else. It was almost always maternal and child health and other issues. And as important as those are, the neglect of the aging and of our population really bothered me. And I wrote the editor and sort of frankly got back a rather caustic letter from him again, saying it's not our field. I think gladly that's changed over the time, but I did choose to do my master's paper at public health on aging and the age of the role of the local public health department. And we became, in Chatham County, a great partner of public health, not only with COVID, but even before. In the Masters of Teaching and Communications, I chose to look at how our older population was viewed in the media and in other ways. And again, that passion stayed with me then and still to today. I was frustrated though with not having the opportunity to engage with others And so I put a notice in the Daily Tar Heel, the school newspaper, that if you were interested in aging, please join me for lunch at Miller Hall, which no longer exists, on a Wednesday at lunchtime. And we had 5 people at that first Wednesday. I would say a year later, we had over 100. And they were faculty, they were students and people in the community. And we called it the Colloquium on Aging and the Aged. I didn't have a lot of money. I was living in a trailer in the woods in Chatham County at the time, but I produced a little newsletter and bought the stamps and kept people informed of not only the meetings of the colloquium, as we called it, and we met at the Catholic Student Center, but also of upcoming opportunities where we could come together and hear lectures. And somebody was working on a grant or had a grant idea and trying to connect. And those persons who were part of that initiative stayed on and became some of my closest colleagues throughout these years, people like Lisa Guither and Dr. Lucy Barron and many others, and really helped spur and my continued interest in the field. I bring up that part because I did that as sort of, again, student volunteer in community service. And I do feel strongly this is not my source, but I hope it will be helpful to students and others who are thinking about whether it's aging or something else, but the importance of volunteering and how it helps you expand your network. But it also just, it's good for all of us when we volunteer, and it helps us test what our interests might be and advance our career goals. It helps also, obviously, to have it on your resume and improve your job prospects, but it also helps you refine certain critical skills, including being resourceful and promoting collaboration and initiative. So I certainly recommend the importance of community service and volunteerism. It led to my really first job in the field, which was on you might have remembered me mentioning there was one course on campus, sociology course. So I actually worked for Dr. Harvey Smith for 1 year, looking at the role of parish ministry in serving older adults. And I interviewed pastors in Orange and Chatham counties. And that really has continued to be a passion of mine as well. And I've been a strong proponent of the importance of our official aging network, also partnering closely with the faith communities. I went on from there to become a aging planner for 4 counties, or rather for 6 counties, and older worker specialist for 4 with the Triangle J Area Agency on Aging, of which there are now 16 area agencies across North Carolina. From there, I worked with the state and became the adult foster care consultant and eventually group home care manager. And we were responsible for developing the standards that govern the adult care homes and the family care homes, and at that point, the group homes for persons with developmental disabilities. A tough field, but a very important field. I strayed a little bit from aging to be a professional relations representative for the Guilford, Forsyth, actually a 12-county area. But even during that time, that's when we were developing the preferred provider program and also health maintenance organization in that area. But I also still volunteered as chair of the domiciliary or adult care home community advisory committee for Guilford County. I left Blue Cross Blue Shield to become executive director of the Evergreens in Guilford County, which no longer exists, but had a great history as a nonprofit, one of the few nonprofit long-term care organizations in North Carolina. Most of them are for-profit or proprietary. But this grew out of the old polio hospital and poorhouse, if you will, that Guilford County ran for a number of years and then got out of the business of doing it. And a group of citizens formed this nonprofit. And it was a very tough position, and yet one of the most rewarding I've ever had in that long-term care. Nursing home, domiciliary care. We had an adult day health program as well. I left there to become coordinator of the UNC Center for Aging Research and Educational Services, or CARES. And as the name implies, we did a lot of research as well as training. and had contracts with the state divisions of social services and aging at that time. Eventually went on to become a planner and then chief of planning and budget, assistant director, and director for 8 years at the Division of Aging and Adult Services. Actually was there at that agency for 18 years as we saw the merger of aging and adult services. Retired, as you heard, and then became the next day, actually had 2 hours of retirement, became director of the Chatham County Council on Aging for almost a little over 7.5 years, and just retired February 1st. And then you heard that I'm still doing some volunteerism. So I wanted to share again with some things that I've learned that's helped me through these years. And again, I'm 69. I turned 69 in November. I have a good friend, Amy Gorley, at one of the retirement communities here in Chatham, who touts "Be bold, claim old." And again, so I'm claiming 69. For senior games, of which I participate, I'm actually now in this age 70 and 74 age group. But the things I've seen over the years is, again, the importance of having values and applying those values and developing the soft skills. I've always said the most important thing to me in either hiring or in any relationship is integrity, the honesty that comes with sharing information, admitting mistakes, just being, in my view, a decent, good person. I've also felt servant leadership is critical. In other words, there's nothing about any of the work of a nonprofit or a public agency or any organization that's too good for you. You need to not be an expert in it all, you can't be, but you also need to show whether it's weeding a garden or whether it's sweeping the floor. What are we here? We're here to serve people. We maybe do that through our research, through our study, or through our practice, but servant leadership, in my view, is critical. I used to believe that you don't burn any bridges, and I think you shouldn't burn many, but I do realize there may be a certain circumstance where maybe you're working in an organization that's not practicing the values that you have, and it forces you to separate and in a sense disown that. But hopefully that's few and far between instances. You want those relationships to be lasting whenever possible. I also feel like patience and vision, anticipation and persistence is particularly important. Patience in our work and in our pursuit of a job, being persistent. We might see something, envision something, but it can't happen overnight, but you still want it to happen. And so that persistence is going to be critical. I had a third grade teacher who had us signed up with little buttons that said, "Don't guess, we always look it up." It was our club. And I do feel that way. I think she instilled in me that we really need to, at that point, rely on the encyclopedias, but we also have to rely on experts wherever those are. You can't know everything. I never became an expert on Medicaid. It was too complicated. If I became a Medicaid examiner, I maybe would have been, but I knew where to go. I knew to go to social services or somewhere else where they had the information. So you trust, you rely on, you develop those relationships, those resources. Continuous learning, formally and through trial and error, as well as inviting and giving constructive feedback. Again, we can't know it all, so you're continuously learning. I hope I'll continually learn throughout my life to that last hour, that last day. Some of it is formal through the education of UNCG's gerontology curriculum, but others through trial and error. Again, willingness to make mistakes, to take risk, but to be also inviting and giving constructive feedback. I think it's Ben and Jerry's who says, if it's not fun, don't do it. And that's not always possible, but it is important to enjoy and have fun in your job. I also learned a mistake I made at the Evergreens and other places is not always to celebrate our successes. I think it is important to celebrate when you have success. Sometimes they're few and far between. And whether it's getting a grant or whether it's a student making an A or a B or a C, whatever they're at, you need to celebrate successes and again, learn from disappointments as well as mistakes. And the last thing here, I mentioned be old, claim old, but I also like the quote from the anthropologist Ashley Montagu that says, die young, but as late in life as possible. Healthy aging, I think, is so important that we stay mentally and physically as active as possible and have fun throughout life. So the lessons, important career lessons, again, I'm borrowing these from another source, Michael Page. It's okay to say no, and I need to do a better job of learning that now in my retirement. I think I'm going to put a pause on some of the other things that I might be asked to do. Hopefully get a job you enjoy. Do the best that you can wherever you're working, but pursue a job that you'll enjoy, that passion. I've never stopped learning. Again, I've taken a couple jobs where I went back in terms of the amount of money I was getting because again, I didn't have the fun, the excitement, the passion that I was looking for. And so I took a different job, even though it meant a little bit less money, because it made me feel better as a person. And it's that work-life balance is also so important. Being a team player, looking after yourself. The disconnect from technology is, again, I probably need to be more connected. Krista can testify to that, but I think it's important not to let technology drive everything. It's important to recognize that a lot of our seniors in the community are not connected with technology. So we need to not always rely on the internet for our communications with them, and obviously live life to the fullest. Why aging at this point? Most of you on this call will know these statistics that are North Carolina, and there may be some who view this video. This will be true across the country and across the world. Not too many years ago, North Carolina ranked 10th nationally in total population. Today we're 9th. We ranked some years ago 10th in the number of persons 65 and older. Today we're 8th. And already we have more persons 60 and older than 17 and younger. And that's true in 85 or more of our counties out of our 100 counties. And again, by 2040, and I think it'll be before then, more than 1 in 5 of our North Carolinians 65 and older, North Carolinians will be age 65 and older. And this is just the website where you can get these statistics and a lot of others from the North Carolina Division of Aging and Adult Services. Again, every aspect, dimension of our society is affected by aging of our population. It certainly is a global issue that between 2015 and 2050, we'll see the population 60 plus nearly double. A lot of those eventually will be in countries that are less developed, and facing all countries are going to be facing as a result health and social systems that are not ready for this major wave of older adults. Just a few of the many report headlines that you'll find if you did a quick Google search. Again, longer healthy life expectancy, the importance of that. I know one of my colleagues in the past at the Division of Aging and Adult Services went to be the faculty at UNC Greensboro, North Carolina A&T, Dr. Yoko Kroom, and did a great job of comparing not only life expectancy, but what she called healthy life expectancy. And the idea was to go ahead and compress the period of time where people are sick or morbidity. And so it's not just living longer, it's living better for many more years. And it's interesting, if you look at some research with National Senior Games, they had a way to look at a fitness calculator for age, and then they compared the age of the Senior Games participants chronologically with their fitness age. And there was about a 15-year, if I remember, difference. So those people who were actively engaged in exercising and competing and keeping fit truly were expecting and living a healthier life for, again, a longer period of time. The stresses, again, we can expect. I will say that I don't want to paint a picture that our mature or aging population is just this silver tsunami that people often reference. I remember there was a Southern Governors Conference years ago that had two major headlines, the silver tsunami, but then they also said that the aging of our population is one of our few natural growing resources, and we have to take full advantage of this aging population in so many different ways. And that is something that we're all charged to do. One of the biggest concerns I have, of course, is the supply shortage of qualified workers in all sectors, but it is certainly true in our paraprofessional and nursing and nurse aides. That is a crisis at this time. But the aging of our population has implications, and you can see on this slide at the far right, all kinds of sectors from housing, healthcare, social services, law enforcement, ministry, leisure, transportation, environment, technology, engineering, education, farming and food, politics, economy, taxes, city and regional planning, and so much more. Law enforcement, for example, is again getting the necessary workforce, but it's also dealing with fraud and scams. We could go through each one of these areas and discuss. So why should those who are thinking of a career in aging be optimistic? If you haven't already seen it in previous slides, here's some information I, again, quickly found through a quick search of the internet, that for 2030, if you're looking in the area of psychology, for example, you can see the projected demand among age groups, the need for additional psychologists who are able to deal with a very neglected area of mental health with our aging population. And then if you look at the areas of engineering and architecture and design, the tremendous, whether it's the use of computers or whether it's the building of smart houses or universal design or the opening of a cereal box, all of these things are critical when you're thinking about, again, an older aging population. If you're interested, like I was, in working with the Aging Network, as we call it, again, you've heard that I worked at the local level most recently with the Chatham County Council on Aging, and then worked with Triangle J Area Agency on Aging and the State Division of Aging and Adult Services. The one that I've not directly worked with is the U.S. Administration on Aging, or used now the Community Living. It's both aging and younger adults with disabilities. The governing act, Older Americans Act, passed in 1965, the same year as Medicare and Medicaid. But this aging network really is critical. It doesn't have all the money. It has much, it pales in comparison, for example, to Medicaid. But it has a very broad mandate and will continue to be an important resource within our communities. So why focus on aging? It's important for all these reasons and more, for ourselves, as well as for our community. Big issues around malnutrition, transportation, Alzheimer's disease. In Chatham, it's now the third leading cause of death among older adults. The stress of family caregiving, elder abuse, neglect, exploitation, scams, abuse, inactivity. Again, I've talked about that already. And again, I've talked about the importance of elevating attention to mental health. At the Council on Aging, we had a staff and board meeting, and we came up with this sort of elevator speech, which was, getting old can be lonely and challenging, so we must be prepared to offer services, programs, volunteer opportunities, and promote livable and senior-friendly communities so that seniors feel more secure and live more fulfilling lives. So as I look to your future, here are a few of my suggestions. First, realize again, as I've already articulated, these are critical areas that regardless of where you land, whether it's in a healthcare setting or as an engineer or a researcher or a scientist or wherever, that you'll understand the importance of housing and the importance of helping people age in place in the community. Whether to also, and this was never more apparent than during COVID, of avoiding social isolation and loneliness. making sure our neighborhoods and communities are livable and senior friendly, that transportation's available, and that also there's aging and physically inadequate, adequate dwellings, affordable dwelling, if you will, too. One of the textbooks that I really found helpful in recent years was Aging in the Right Place by Dr. Stephen Gallant. Hope I'm pronouncing that right, of the University of Florida. So your potential roles, we've talked about this already. It could be in the educational realm. It could be an advocate. Again, the long-term care ombudsman, which are part of the area agencies on aging, are advocates for residents of nursing homes and assisted living facilities. You could be an administrator of an organization, a nonprofit, a public or a nursing home or some other entity. You could, in fact, be an engineer or a designer or a community planner, a community organizer, a financial advisor, a journalist, doctor. One of my first members of the Colloquium on Aging and the Aged was, I'm drawing a blank on her last name, but she eventually became head of the School of Journalism at UNC. And she did a early video, if you will, on the myths, the mask, and the media in terms of the aging. And so journalism is important. Health and human service provision, both professional and paraprofessional planning, policy making, estate management, law, and so again, so much more. The important point is that I think almost every job that you could be in, even with childcare, you have grandparents raising grandchildren in increasing numbers. And so the importance of applying, taking, understanding, using your knowledge, your experience in gerontology will remain critical, whether you are formally in a gerontology position or in any position where you just apply those knowledge and skills. So again, test your passion, as I did in community service, volunteerism, or various jobs. Realize the importance of continuing to develop and apply that knowledge in soft skills, as well as the hard skills. Maybe explore the aging network in your area of North Carolina or across the country. Recognize again that aging, this field of aging, cuts across all disciplines, is very interdisciplinary. Be patient and persistent. Make sure that, again, you're being true to yourself, but understand that things don't always happen overnight like you'd like. I would have liked to have maybe had a position in aging that I didn't get, but I stayed with it as long as I could because I knew it was important and good things would come. Be visionary and a doer. It's not just seeing the dream, it's really working toward it. And continue to network, build those relationships, connect the dots, be efficient in your work so that one thing can also complement and supplement something else. And help us avoid ageism and dispel the myths that are still too common in the community. One of the things we did in Chatham to address the housing problem, for example, was to begin to engage young people through the faith communities. And they were helping to do some minor home repairs through an organization called Rebuilding Together of the Triangle. But we also developed a little mini curriculum that they went through, the youth went through before they started the work so that they could understand some of the myths of aging, dispel those myths, understand what it was like to grow old, and understand that hopefully they will also age and age well. So this is a little poem. In fact, I just recently found the author. I always said it was anonymous, but Dora Johnson wrote this, which I do like. You tell me that I'm getting old. I tell you not I tell you not so. The house I live in is worn out, and that, of course, I know. It's been in use a long, long while. It's weathered many a gale. I'm really not surprised you think it's getting somewhat frail. The colors changing on the roof, the windows getting dim, the walls a bit transparent and looking rather trim. The fountain's not so steady as once it used to be. My house is getting shaky, but my house isn't me. My a few short years can't make me old. I feel I'm in my youth. Eternity lies just ahead, a life of joy and truth. I'm going to live forever there. Life will go on. It's grand. You tell me that I'm getting old. You just don't understand. The dweller in my little house is bright and young and gay, just starting out on a life to last throughout eternal day. You only see the outside, which is all that most folks see. You tell me that I'm getting old. You've mixed my house with me. I truly do believe that a lot of that is about the spirituality, however, whether it's formal or not. It's about the importance of staying active and healthy as much as possible. It's the importance of respecting people for who they are and understanding a bit more about what they've gone through. One thing that I have not included in my slides that I think about a lot, and that is, again, the importance of, again, equity and inclusiveness that have become so important in our discussions. And I would hope that they become, again, part of our policy and practice more than they are currently. As I end, I oftentimes in my work had cited this from Martin Luther King. What are you doing for others as life's most persistent and urgent question? And tonight I'm wearing this yellow and navy blue tie, and both in honor, I think it's maybe UNC Greensboro's colors, but it's also, I think, brings our attention to what's going on in Ukraine. And today I was looking out of curiosity to see if there's any organizations that are trying to tackle the horrid situation that many of our elderly in Ukraine are facing, have faced. And I came across one called HelpAge International, which some of you may be familiar with, but seem to be, I don't know a lot about them, but my quick read, they seem to be doing a good job of trying to bring attention and address the issues. In fact, they started as early as 2014 when Russia invaded Crimea. And on their website, again, this is HelpAge International, they give the stories of some of the elderly in Ukraine and their words about what they're facing. Again, some of these same people were alive during World War II as young children and faced the horror of the Nazis and the invasion of concentration camps and so on at that time. I bring that up again because I just personally, I can't forget what's going on in our world as I speak tonight. But I also see that as an opportunity when I talk about what I did with the colloquium on aging and the aged, that a person can, in fact, take this as an opportunity to raise awareness, to somehow connect, whether it's with HelpAge International or some organization, and find a way as a volunteer community service to bring attention to this, particularly as it pertains to older adults. And as you do that, you are establishing, testing your passion, but you're also beginning to network, establish relationships, and it may lead, in fact, to a career or a job. It certainly will strengthen your passion. With that said, I do want to thank you and wish you all the very best. And again, for me, aging isn't just a job or a career, it's a passion. And I encourage you to enjoy it personally and professionally. Thank you.
Thank you so much, Dennis. That was really inspiring. I'm going to open it up for questions. If anybody has any questions for Dennis, I know I have a few that I'd love to tap his mind and see how, what his thoughts are, but I'll open it up to everyone else first. Okay. Please, Rebecca, go right ahead.
Okay, thank you. First, thank you for that. That was awesome. And I just wanted to mention, I knew we were probably close to the same age, but I want to claim my age or claim old or whatever. I'm 2 months older than you are, which I never knew it was that close. My question actually has to do with something you mentioned way in the beginning of your presentation. When were you doing that research on the role of parish ministers in serving the elderly?
Yeah, it was 1978 and 79.
Okay, I mean, it's kind of an interesting thing because that was, of course, a big deal in the late 60s and 70s, you know, focusing in on partnerships with the faith community in developing service models. I know Bob Weinberg, who I'm sure you remember in social work, really focused on that area in developing ties with the faith community in Greensboro. And coincidentally, the first research I did in North Carolina was in Davidson County, back when someone I know you remember, Lynn Perrin,
Yes,
was
absolutely.
around. She was the AAA director for 5 counties that included Davidson, I think, at the time. But we surveyed Davidson churches, and I've been meaning to mention this to Krista, given her career. I mean, there was only one article out of that data, but we found out what they were, all the networks that people had in churches and things. And I remember someone telling me that you had done some work in the area, and it's kind of funny. I think it might still be on my to-do list from when I first got to Greensboro to contact you about that. And I don't think I ever did. But the other thing I wanted to mention is I really appreciated you mentioning Stephen Gallant's book, because there's another synchronous coincidence. He was my very first gerontology professor at the University of Chicago, which he left, you know, to go to Florida. But I also had my first incomplete with him in my coursework, and that became my incomplete with Stephen Gallant became my first sole-authored publication. And it was indeed a spatial aspects of aging class. So I was very interested to find out that, I mean, I'm assuming that's a fairly recent book.
Yes.
That he's still writing in the area. And I was curious what you found useful about that book, since I haven't seen it. Since you highlighted it, I was curious about it.
Right. A couple things about that. I loaned that book out recently, and I don't know who I loaned it to, so I don't physically have the book anymore. But anyway, what I found about it, it was written in such a way, it was very, very useful, practical. It didn't present any great surprises to me, but all of it was really focused on what is essential to, again, helping us help older adults age in place. You know, at the Evergreens, obviously, I was a nursing home administrator and proud of that career as well. But I've met very few people who want to go into a nursing home or a long-term care facility. And so, you know, he was looking at all the various dimensions that are essential to helping people age in place. And it was written from that would be useful to somebody who is a policymaker, as well as a practitioner, as well as a family caregiver. So I thought it was very useful guide that he had developed. Actually, my father-in-law, who's since deceased, was from the University of Florida, and obviously knew of my interest in this field, my work in this field, and gave that to me as a Christmas present. So that was something I cherished. I hope I get it back someday. If not, on the faith community thing, a couple comments there. I still obviously feel that connection is so important, but I always have to caution because over the years when I was at the state, I may get myself in a little bit of trouble, but I won't name names. I had a couple occasions where people would say to me, I just don't understand why we just don't let the faith community handle all of this. And I'd have to explain that there's just too much this to be handled by one sector. That we have to work together to, you can only provide a person so many 3-bean salads, and they're only going to do it once a week. So to have an idea that a faith community or a church or synagogue or a mosque, whatever, can completely take on the needs of our older adults is wishful thinking. Similarly, I would have to caution and remind those of us who worked in the aging network that we can't do it all either. So we don't need to be threatened by some organization like North Carolina Baptist Aging Ministry, NCBAM. In fact, NCBAM came to me early on as it was a concept, and they're in Davidson County, if I remember. Sandy Gregory's great, Dr. Sandy Gregory. And they came to me, and Bobby Boyd was retired as the social services director up in Catawba County, and he was part of it. And they wanted to do extra things. And I said, that's great, but I will tell you that we can't meet basic needs at this point. So I hope you won't entirely separate yourselves from food security, from housing, home repair, and they didn't. Every other year they do ramp it up, building ramps. They have special efforts to, again, provide food, and so they've partnered with our network over the years in a very productive way. And Krista, I think you're with you've done some work recently with the North Carolina Council of Churches. We obviously have to be doing all of this together as a partner. None of us can do it alone.
I did have one kind of self-reflective question, I guess, and I am curious about this. I mean, of course, when I first met you, you were working at the state level, and I was, it's unusual to go from the state level down to the county level, and I was wondering what that was like, after being up at a higher level of intervention, to be focused more on a local community.
Yeah, I like, of course, I like both. But I will tell you, I take great satisfaction, and you may have seen that in some of the words I used, and even the idea of passion, the closeness of working with our older participants has true meaning for me. It reminds me a lot of my work in my dad's office, being able to put the hands on. Having said that, the other thing that was very interesting, and housing is such a big issue, and we've tackled it well in Chatham County. There's a lot more to be done. But initially, I was going to use one of the major sources of funds called the Home and Community Care Block Grant to support our housing program. And we did use a little bit of money the first year I was there. And then I discovered how onerous the regulations were that I had signed off on. In fact, the administrative letter was one that I signed that said, this is not practical. So we did not do it after that first year. We did not use that source of funds. So I guess where I'm going with that as an example is, there's a lot to be said for the boots on the ground, the grassroots, for those of us who are policymakers, to understand that things that look good and sound good aren't always as practical at the real level, at the grassroots level. It takes all of us together. Even during the COVID period, I was strongly advocating through the North Carolina Association on Aging that the state, the department, engage those of us at the local level as quickly as possible, so that it wasn't just dictates from the state, but that we in fact are helping to shape how things rolled out. Because I think they have information we don't have, but we also have an understanding that they may not see.
It's interesting. As you were speaking, it occurred to me that an example from that first Davidson County study I did is relevant. The reason Lynn Perrin contacted UNCG, and it was actually Vira Gibbett, she contacted, and it was delegated to me. But the reason was that the state had mandated a funding formula that had been developed by the General Accounting Office based on research in Cleveland, and it didn't fit. And Lynn was appalled that the money was going into, I think it was caregiving, and what people needed was transportation at the time. So it, and she went in the other direction, and up to the state after that to fix it, I think. So that's it's very interesting to have your perspective from both levels. I'm sure that was really helpful to the state to have you down on the ground where you could see things from a different perspective. Thank you for sharing that.
Oh, sure. And actually, Dr. Vera Kivett was great in looking at rural aging. And again, why you can't just dictate things from the state in a very rigid way is we look very differently across the 100 counties. And that is something Lynn helped with development of in the early 90s, the Home and Community Care Block Grant that gave greater responsibility, autonomy to counties in deciding on which services and how to use the funds that were available.
And I didn't make the connection that she had actually helped fix what she went to fix. So that's awesome to know too.
Yeah.
Thank you.
Sure.
Dennis, I noticed one of your first real projects after working with your dad was related to research. So I was wondering if you could speak a little bit to how maybe research has played a role in your career and kind of the relationship that you've had with research throughout, the different things that you've done.
Sure. Yeah, I think it's that marriage between practice and research and education is just so vital. And I know, again, we were talking earlier that you're involved with the Journal of Applied Gerontology, and it's so critical to be able to take the good work that you all are doing and learning, whether it was originally, again, Dr. Vera Kivett and Dr. Adams and now yourself, and others to help us at the practice level and the policy level to understand what it means. I'll give you a couple examples. I remember at the state level, you'd have a horrific incident where maybe an older driver would make a mistake and be in an accident that resulted in a fatality. And you'd see an overreaction on the part of media, but also particularly it plays out in terms of some policymakers. And if it wasn't for the ability for us to go to some place like the North Carolina Highway Safety Research Center or to a faculty member at one of the universities to say, what can you tell us about the older drivers and the incidents of accidents? And otherwise, we would have been facing decisions and laws and policies that would have been very ageist. So the critical nature of being data informed, data driven is so important. I brought that idea to the council when early on in 2015, we were one of the first nonprofits to be selected to be part of Blue Cross Blue Shield of North Carolina's Leadership Academy. And we were asked to select a project, if you will. And we understood that we really didn't have the wherewithal to do the kind of decision making on programs and services and direction that we needed because of our lack of data and our lack of connection. So it took time. Being patient and persistent, we finally were able to, in fact, in my last year at the council, develop, install a software that hopefully will help us in the future. But more importantly, we established the relationships with various universities so that we could invite in faculty and students, graduate students, and some undergrad to help us and do analysis of our various services and programs and what worked, what didn't work, what we should be prepared for given the changes in the community and so on. So I can't overstate the importance of research. I wish I was more equipped to have done more myself, but again, just my early experience with it told me that it was critical.
Thank you so much for answering that. Does anybody have any other questions?
I just wanted to comment. I also wanted to thank you for, I don't know if facilitating or allowing is right, but Krista's research, which of course is exactly the kind of thing you were talking about, data in Chatham County. And of course, you know, she won 2 awards for it. And you know, we're very proud of her in the gerontology program. And of course, I know she was working with you when she did that research. So another tie-in.
Well, I wanted to thank you for bringing that up. And I'll give you an example, again, in practical terms of why that's so important. And she certainly was a wonderful colleague and outstanding contributor to our work. And I knew she was doing that. But we increasingly found, not just with United Way, but with other grantors, their expectation of looking at, first of all, before they awarded anything, of what's the justification, what's the evidence. Evidence-based is the common term, or at least best practices. And Krista did an outstanding job of being able to unearth what existed that we could use in those grant applications to really not only impress the ones that potentially were going to give us the money, but really gave us a basis for going forward with it. Again, you also know that so much is now not just about outputs or inputs, it's outcomes. What difference are you making? So again, to be able to do that, you sort of have to have that construct on the front end to understand what we're going to be measuring and what's the effect. One of the examples that, again, Krista helped us with, and it's very impressive, is through our caregiver respite program. I know you mentioned that a few minutes ago, but we're able to demonstrate that we kept over, I think it was well over 95% of our participants in that living at home, dying at home, instead of going into facility, as a result, largely as a result of the caregiver respite. We found over time, when I was at the state level, that our Meals on Wheels program, that's supposed to be 1/3 of the minimum daily nutritional requirement, actually for about half of our participants represented half of their food intake. Again, bringing the idea of food insecurity. Looking at UNC hospitals, research out of their emergency room that showed for an older population, if I remember correctly, about half of the people they were seeing were malnourished, and about half of those had not had a previous diagnosis. So, being able to know where to look for those kinds of data, and then being able to use it in your work, again, Krista was great at. Thank you.
All right, I'm going to ask one more question and then we'll wrap up. Dennis, you mentioned a lot of the intersections of gerontology and aging with other disciplines, and the multitude of career opportunities that exist. And so I do think there's a lot of things that are already, a lot of opportunities that are already in place for, say, gerontology students to kind of pursue. But I would love to hear your insight on what you think is around the corner. Because I do sometimes tell my students, that I think there are opportunities that are in careers that aren't even in existence currently, but are going to kind of rise to the top with our aging population. So I want to know kind of what your thoughts are on this, and if you think there's kind of a new career path that's going to be emerging related to aging.
Yeah, I actually been preaching about this now for about 20 years. So, but I think you're still on the right track. I think it changes certainly over time. It won't be a quick transition, I think. I think the most important thing that you've instilled in and provided your students is, again, the basic knowledge and the skills, both the soft and the hard, that they can use. That's why I use the term patient but persistent. Some people will, depending on their, maybe their additional discipline. If you're a nurse, obviously, or psychologist or physician, you can probably readily find that path. If you're an engineer or an architect or somewhere else, you may have to do a little bit more to find it. The important thing, though, is you're bringing with you the breadth and the depth of knowledge that you can not be shy about sharing. The livable senior-friendly community. I was at, I'll say, at Walmart today, getting something here in Chatham County, and I was reminded as I was trying to navigate the parking lot. If you compare Walmart to Target at most places, Target's an easier way to go, because they've got that sidewalk lined up along there and you can safely move and navigate through. These are simple things, but they're not. With an aging population, we have to realize that, again, this we've got to have increased awareness of what all of this means. I think that's why I've emphasized the importance of students reaching out to wherever they may be, whether it's geographically or in organizations or connections, to show their passion that they may have. I feel strongly that we have such shortages in our healthcare professions. So, I mean, that's the obvious one. Whether it's in therapy or otherwise, you're going to find a position, and we need you desperately. In some of the other areas, we've got to do more learning or teaching, rather, of others about what it means to be in a livable and senior-friendly community. I still, as much as North Carolina and Chatham County, I think, have made great strides, I'm still disappointed that recently, it wasn't UNCG, but I went to one of the universities this last year and in search of an intern who might be interested. And I was told that they didn't have students really interested in aging. And that was so disheartening. There's such opportunities. One of the last things I did in talking with my nonprofit board was to ask, and I think it's going to happen, that we set up a scholarship for students, for a student each year, to try to encourage and support their work. I'm giving you not a direct answer. It's a work in progress. And I think it depends on a lot of attention and support from not only from the academic side, but from government as well as from business. Again, simple example in livable senior-friendly communities. I think it was Austria that found that when they designed their stores to be senior-friendly, they were good for everybody. And that meant putting staples on a lower shelf, or a bench here and there throughout the store. Simple things that, again, everybody liked. And this is the knowledge, the skills that your students can bring to their business and will help elevate not only the field, but themselves and their job and profession, if that makes sense. I hope it does.
Yeah, absolutely. I think for a lot of people, it's almost overwhelming when they get a degree in gerontology, because there's not an automatic job match, right? Like, you don't search for gerontologists and a bunch of jobs just kind of pop up. You have to really do some navigating to align that passion that you have and kind of your special interest in aging with certain career paths. So it gets a little intimidating, and definitely job advising for students in gerontology is sometimes feels a little tricky.
Right. And I do know there's some professions like case management and even planning or architecture and so on, where you can become certified, further certified in gerontology, or as a gerontologist. I don't know a whole lot about that. I haven't had a lot of experience with that. I suspect, though, over time, those even become more valued and more useful.
Well, I certainly hope so. Okay, does anybody else have any questions? I feel like we have an expert here at our service. We should tap into this. All right, well, that will bring us to an end then. Dennis, thank you for delivering such an inspiring presentation and sharing with us how important a career in aging is. You've truly had an amazing career, and for some reason, I don't think you're done. Like, I feel like you're still going to be touching lives and still doing amazing things, you know, in your future. So I want to thank everyone in attendance for their time and attention this evening. We hope you have a wonderful Careers in Aging Week. Just a reminder, it begins next week. So please go out and tell everyone about the different opportunities in aging. Thank you so much. Have a wonderful evening.
Thank you.